Welcome everybody to our iMedisync and Rostrial webinar. It's a two-part series. This is part two. So if you missed part one, please email me and I will make sure you get the recording. It'll also be on our YouTube channel, iMedisync Americas. My email is up there at the top under my picture. And so for part two, we have Mastering Brainwaves, EEG, PMS, and QEEG Fundamentals. This is reviewing clinical and research applications with our presenter, Sherry Johansson. All right, just a little bit about us. This is our American team. We're a very friendly group. We love to connect on social media and to hear about what you're doing or what your goals are. And if you'd like to learn more or know any questions, please ask. A little bit about our services is we have an amazing software that's a normative database that does age and gender differentiation. So a 13-year-old female will be compared to a 13-year-old female and not a male. Our device, which you can see behind my shoulder right there, is a 4-in-1 device. It has EEG, which is FDA cleared, and HRV, and the interventions include transcranial photobiomodulation, as well as neurofeedback through Brain Boost. A little bit about Rostrial. They're one of our favorite companies to work with. They're a great distributor with continental projections in Brazil, hence why we're doing English and Portuguese tonight. And they're very professional. I love working with them. They have a wonderful vision and a wonderful mission to help others. Our moderator will be Dr. Bruno. He is an amazing neurosurgeon and researcher. He's currently working on research studies using QEEG and AI for Parkinson's disease and chronic pain. So we're glad to have him here. He's actually on vacation, so thank you for taking time to be here. And again, if anyone hopped on in the last little bit, please turn your interpretation on. So you'll go to the More button at the bottom and you will select interpretation and select English or Portuguese. And Dr. Bruno, I'll turn it over to you.
Obrigado, Rebeca. Gostaria de agradecer mais uma vez a Rastreal, a MedSync, pela oportunidade, né, de a gente ter um evento desse nível, em que a gente pode ter pessoas do nível da Sherry compartilhando uma experiência enorme que ela tem com o QEG e EG, né, e vai ser um prazer a gente poder ouvi-los, né, assim como foi na primeira parte, que o Corey falou muito bem para a gente em relação aos conceitos básicos, né, do QEG e da estimulação magnética transcraniana. Então, hoje a Sherry vai falar um pouquinho mais para a gente sobre as aplicações clínicas, né? E no final a gente vai ter um tempinho para as perguntas e a gente poder também colocar um pouquinho de questões clínicas, né? Afinal de contas, muitos aqui também são clínicos, lidam com pacientes na ponta, então é de grande interesse para as pessoas, médicos, estudantes e psicólogos e todos aqueles que trabalham com QEG e estimulação magnética transcraniana. Então, gostaria mais uma vez de agradecê-los, o Corey, que falou da primeira parte, e hoje também agradecer novamente a Sherry pela apresentação. Muito obrigado.
Thank you, Dr. Bruno. Okay, financial disclosures. There are none. I just enjoy working with everybody at the team at iMedisync and now my new friends at Rostrial. So today, what we're going to talk about is the EEG QEG advantage and all of the clinical and research applications. We're going to talk about the utility of EEG, both in clinical practice and in research, why it's a valuable tool, and how you can use it as an instrument in your treatment that you do in your clinic or as a research tool. These are just my my business, Total Neuro Solutions, and we're calling this the EEG Advantage Clinical and Research Applications. So Corey covered most of this, but what is EEG? Electroencephalography is used to measure electrical activity of the brain. We can use it for clinical assessment, research, for confirming diagnosis, guiding intervention decisions, and providing real-time brain functional analysis. This is the iSync system, and it's the easiest way to learn how to bring EEG, QEEG, and now photobiomodulation and neurofeedback to your practice. A quantitative EEG is the outcome of computerized process that transform those squiggly lines into information that we can use through the head maps, the reports, the comparisons, and the ratios that the iSync report gives you. Why is EEG important? Well, it's basically because why would we treat an organ that we can't examine? And there are lots of ways to examine the brain, but EEG gives a ton of information, and it's non-invasive, cost-effective, and it can provide functional insights as well as biomarkers for treatment decisions. The other thing that's interesting about using EEG instead of MRI or more expensive brain scans is it can help us detect focal abnormalities such as tumors, transient ischemic TIAs, attacks, stroke, and any anomaly in the brain. So I'm going to show you, this is a great picture of what's called FERDA. It's a delta wave that when we put it into a different montage, we can see that it is stronger on the right. These are small little numbers, but FP2 to F4. This is the largest amplitude of this delta wave. We know it's a delta wave by how many times it cycles per second. The green lines are 1 second intervals. And so this is a great example, one of my favorites that I use to show delta activity that is focal. We call this FERDA, frontal intermittent rhythmic delta activity. This is in a 67-year-old patient. It's a high voltage, well-formed delta. And this helped us get her to a neurologist, and we found out that she had a brain tumor. So being able to see this on a routine EEG is very powerful. Other conditions where EEG is valuable. It's being used a lot in traumatic brain injury, TBI, because we can get somebody, relatively quickly into the clinic to get an EEG and to determine the area where they had impact to the brain. Autism spectrum disorders. There are biomarkers for autism that can be seen in the EEG. There is a pattern that's pretty specific to developmental delay and autism. We can even look at mood disorders, anxiety, bipolar depression, traditional major depressive disorder. We can look at movement disorder, tic disorders along the motor strip, thalamocortical dysrhythmias, which can cause tinnitus and other symptoms. We can now get early detection of dementia and Parkinson's by looking at the EEG. When people are just beginning to have some symptoms, we can look at the blood flow to the brain through the EEG. And we can also see developmental delays as early as 4 years old in the iSync system. How it can be used in research is, we can track brain activity under different conditions, at rest, under task, math task, etc. We can use EEG to be able to see the neuroplasticity when we apply different medications, different modalities that increase neuroplasticity. We can measure that growth through using EEG. And it can be used in cognitive and psychological studies. So some examples of that is it's being used to study brainwave patterns in meditation at UC San Diego, identifying biomarkers for mental health conditions. That's by Kropotov, Arns, Gunkelman, and Johnstone. They started that with the phenotypes and other biomarkers that have been examined and researched in the last few years, actually. Meditation studies are very interesting. What we're finding out is that meditation increases the power of alpha, the synchrony of alpha, sometimes theta and gamma as well. So pretty healthy for the brain. Amazing research going on there. The phenotypes, this was started years and years ago, like I said, with Gunkelman and Johnstone. They've also looked into using those phenotypes for medication predictors using the EEG. And this is a slide of the phenotypes made by Johnstone and Gunkelman from 2005. And it's a great shorthand for when you're reviewing your EEG, putting it into the category of a phenotype will help you understand, like, your EEG findings are low voltage EEG overall. Well, that's a phenotype. And with that phenotype comes some suggestions for interventions, both with PBM, neurofeedback, and other interventions. So I love having this shorthand of phenotypes available to us. Another phenotype that's more recently found was from Martijn Arns and his study. These are the biomarkers found in his research using the predictive value of grouping people based on their individual alpha peak frequency as a biomarker for grouping them according to whether they have a slower alpha peak frequency, and that would be in the blue. It's called the low decile score because they put it on a 0 to 10 scoring rule. And so if you're in the blue and you have a lower alpha peak frequency, that determines what the intervention for TMS would be. And here it would, they would often recommend certain medications that would speed up your background rhythm. And then if you're in the orange, that's kind of the normal peak frequency, and the traditional beam 3 dorsolateral prefrontal 10 hertz alpha should be fine for TMS if you fall into this category. And then if you have a fast alpha peak frequency, like shown here, you would get a 1 hertz at the F4 location or the right dorsolateral. So this was groundbreaking in being able to group people according to their decile score and apply TMS that was very effective when it had not been effective in the traditional manner. So this is an example of how EEG is used in research to help implement treatment. And this is just that person had a very fast alpha peak frequency, and so they received the 1 hertz on the right dorsolateral prefrontal with success. Here are some other mental health conditions that we have biomarkers for. So one of the biomarkers for major depressive disorder, and believe me, there are more than just one, but one that has been researched well is frontal alpha asymmetry. And this predicts the treatment response for medications as well as neurofeedback and TMS. Anxiety and PTSD often have high beta and a deficit of alpha. And ADHD, the traditional ADHD was high theta at the anterior cingulate and a high theta to beta ratio. We now know that there are more than one biomarker for ADHD as well. Schizophrenia has a biomarker of low gamma and high theta. It impairs cognition, and you can have hallucinations with that as well. Bipolar disorder often has biomarker of decreased gamma in mania and spindling excessive beta, and that's what SEBs are, spindling excess betas. Autism often has theta and gamma abnormalities. We certainly see an excess of delta and theta in most of our kids on the spectrum. OCD is often frontal beta. It can be also in slower bands. So even though these are the ones that are most researched, we have other information that, there can be a couple of different manifestations for some of these disorders. Insomnia is often high beta or gamma during sleep, but we often see it in our eyes closed EEGs with a beta spindle at CZ. So these are the ones that are most researched. We also have research from Rob Coben on connectivity, and he's looked at the brains of autism spectrum disorder kids, and he has found that there is often hypo or hyper connection. And what I love about our iSync reports is we get these beautiful graphs that not only tell us whether they're hypo connected or hyper connected, but also which areas of the brain, whether it's the right hemisphere or the left, but also which structures are involved. So, on the right side is the right hemisphere, on the left is the left hemisphere, but you can see the structures. This would say parahippocampal on the right hemisphere is hyperconnected with the paracentral on the left hemisphere. So we get a ton of information using our connectivity maps in our iSync reports. EEG also helps assess our efficacy of our interventions. I have implemented photobiomodulation for almost 10 years in my practice, and we can see changes in the EEG after 15 sessions of PBM, as well as neurofeedback stimulation and the other treatments that we provide. It allows us to adjust medications. As mentioned before, with the phenotype model, it can help determine which medications would be suitable. So a lot of people who come to us for EEGs have failed other treatments or medication attempts, and we can look at their EEG and determine which classification of medication can be used. A lot of docs are also now using blood work and DNA testing for medications. These two together work beautifully. I've worked with a lot of functional medicine doctors who look at the EEG and the patient's blood work and determine the medications. And this could be after failing 3 or 4 attempts at medication. So if you want to use it to monitor, you can look at, you take an EEG, you find out that there is epilepsy involved, and then you start them on their medication, Keppra or whatever the prescribed medication is, and give it a month until they're stabilized on the medication, and then take another EEG and see if it is effective or not. This is also true using stimulation implants or doing surgery. You can track neurofeedback or stimulation interventions. And again, every 10 to 15 sessions, you can take an EEG and see the progress or the lack thereof. And the lack of progress would tell you to change your intervention. As I've mentioned, we can use it with PBM and seeing the effects that it has. I love it with blood flow with my elderly clientele. We can also see if you are suitable for certain psychedelics and also the effects of those psychedelics. 5 years ago, there were very few studies on this out, and now we've taken people's EEGs during the time that they're under the influence, and we can see that it increases their theta and gets them out of their default mode. So it's amazing to be able to watch what the brain is doing on certain medications. We can also test our outcomes as far as our treatments with mood disorders. The clinicians who are using EEG for their interventions are TMS practitioners. This has gotten really popular again recently because of the accessibility of EEG and the fact that they can They can take EEGs every 2 weeks and see if the EEG is changing along with their client's symptoms. Same with photobiomodulation, stimulation technologies, medication response, neurofeedback, and surgical interventions. So now I'm showing you, this is the little head maps that you get on your iSync report. And this is the FFT, the fast Fourier transform of a client with treatment-resistant major depressive disorder and OCD. If I could enlarge this, you would be able to see that there is a little bit slower than 10 hertz peak, pretty generalized, but over the frontal region, the prefrontal cortex, and also a 20 hertz that's actually the same size or taller than the alpha peak. And so this is why she did not do well with medications. If she took an antidepressant, it would speed up the beta. If she took something that would take, like gabapentin, that would take down the beta spindle, her depression would get worse. And this is where TMS and neurofeedback shine, because we can go in and modulate both of these peaks. And so what happened with her is, we were able to actually target both of these. She had failed TMS at the left dorsolateral prefrontal, and so she ended up with a specified customized TMS protocol. This is also on the iSync report. This is the same client, and you can see that this is showing the beta peak as well as some slow and where it is on the head. And another thing that I love are these images that give us the Brodmann area in the anterior cingulate for the location of this fast beta frequency. And this would definitely be spindling excess beta. So for those of you who attended Corey's presentation, this is a review. This is, you get the raw signal here in the time series. You get the power spectrum on the FFT, with power being on the y-axis and the frequency being on the x-axis, as well as the beautiful colored head maps that everybody likes. As Corey said, you want to make sure that if you are looking at hot spots on your topo maps, that you also can see this in the spectrum analysis, and always go back and check and see if you're seeing the beta spindles as well as the alpha waves in your time series. So this is a different example of treatment-resistant depression in a 44-year-old, and this is the before the treatment and after the treatment. This was 30 sessions of TMS, and this was more traditional high frequency training. They used a 10.8 frequency at the left dorsolateral prefrontal, and it reduced the alpha tremendously and resolved the depression. This is the head map of an 80-year-old with depression, and she didn't know that she had mild cognitive impairment. The QEEG detected the alpha frequencies in the temporal lobes, and this is correlated with low blood flow. Theta and alpha are a low blood profusion. And so we can see that she needs blood flow to the brain. And so we were able to intervene here. She can still make a fast enough background frequency, but she was not getting enough blood flow to the temporals, and she was having short-term working memory, verbal fluency, brain fog, along with her depression. And here's the before and after. So you can see how much the EEG changed. Again, the chief complaint was unrelenting depression. She did have some word finding and short-term memory issues, some long-term semantic and declarative problems. But because of the data that the EEG revealed, we found out that she also met the criteria for mild cognitive impairment. And so we were able to intervene with the Bredesen protocol as well as PBM to get good blood flow. She got on a good diet and a good walking exercise regimen. And this is the difference after 30 sessions. The other cool thing about EEG is we can do low resolution topographical analysis, Loretta images. And for those of you who use the iSync, you know that when this is on your report, you can turn this brain and you can see the powers, the voxel powers based on these colors. You can look at the left side, you can look at the dorsal side, you can look, you know, on the right side. You can spin this and get a really good idea in a 3D analysis of what's going on in that brain. What I do want to remind you of is even though we have all of these beautiful pictures, you always have to go back to the raw and make sure that you have loaded into the AI a pristine, well-artifacted EEG. If you can take a clean EEG and remove, any gross artifacts, and now they've made it very easy for us in the reanalysis tool on iSync, as long as you get a beautiful EEG put in, you're going to get beautiful results from your iSync analysis. When to refer to a neurologist if you're not a neurologist. Anytime you see focal abnormalities like the focal slow that I showed you, paroxysmal activity, giant burst of disorganized EEG, encephalopathies, really, really slow global frequencies, and epileptiform content. These are the times to get someone in the medical field looking over your shoulder to make sure that you've got medical oversight or a referral to a neurologist for treatment. This is a great example of one of our clients that did not come in with a diagnosis of seizures. There were no clonic or tonic seizures in this patient. But when we took the EEG, here were the markers. Traditionally, IED markers were contraindicated for TMS, but now the latest research shows that actually you have a more compromised client using SSRIs than you do with TMS. So we would say for TMS providers, even if you see this, you can use TMS to ameliorate the problem, but proceed with caution. And again, this is where neurofeedback shines in that it is one of the things that we do very, very well. It's not as fast, but it's very, very safe for all of your clients with seizures. Advantages of using EEG and quantitative EEG over MRI and CT is basically that it's accessible, it's fast, it's affordable. You don't have to worry about EMF exposure or radiation concerns, and it gives you functional insights, not just structural. The Loretta tomography gives you spatial resolution to 7 cubic millimeters, and it gives you better temporal resolution, but worse spatial resolution compared with an MRI. CT uses ionizing radiation, and we don't want to do that every few weeks. And certainly we don't have that problem with EEG. The MRI uses non-ionizing radiation, and both are considered safe for occasional use. But when we want to monitor our interventions and we want to take our EEGs to know what effect we're having on the way the brain functions, we can do this without any concern about radiation or EMFs. And the reason that EEG is preferred over behavioral assessment alone is because it is physiological data, not just subjective reporting. In my practice, we use both, and I highly suggest that you correlate those. But this gives you physiological, quantifiable data that changes over time for excellent tracking of progress. You know, there's a move towards personalized medicine. People are wanting something different than what Western medicine has offered, and EEG is a great way to help get to the root cause of so many disturbances, behavioral, emotional, as well as mental health. We can identify the brain activity patterns. We can use our clinical expertise to correlate that to the client's chief complaint, and we can tailor interventions individually to each client's needs. Another way that people are using EEG is to customize neurofeedback for ADHD, mood disorders, autism, assessing suitability for ketamine. And one of the things that would give us pause with recommending ketamine for somebody with a history of trauma is if they have those spindling excessive beta frequencies, they might not do well with ketamine. We can look at dementia, early detection before people start having symptoms, and we can monitor our effectiveness. Sedative hypnotics, actually increase slow wave. Benzos, even though they calm us down, the next day we get an increase in 14 to 25 hertz. So if we put somebody on Xanax and they get more anxious the next day, we really need to look at their EEG and see if we are speeding up already excessive beta problem. Valium and Ativan increase 20 to 30 hertz and decrease alpha. So these are examples of, why it's good to look before you prescribe. As I mentioned before, EEG is used for TMS optimization. So what we're finding with TMS is, there's a certain number who have to come back after about a year. And if we can look at their EEGs, we can find out why they're not progressing or what patterns have reoccurred. And sometimes that is because of the environment, sometimes it is because of medications, but we can enhance the outcomes for all of our treatments using EEG. Now I'm going to talk about a case of a 54-year-old female. She had treatment-resistant depression, a long history. She had been trying for about 10 years. She had failed multiple psychotherapies, medications, TMS, and she had even had electroconvulsive therapy. So this was in 2023. What we noticed in her EEG is she had an individual alpha peak frequency of 11.5. That's fast, according to Arndt's research. That would put her in the high decile score. We see, if I could enlarge this, you would see beta spindles here at FZ. She also had some beta spindles in the central region at CZ. She did have some theta waves and alpha asymmetry. And so you can see in the topo maps of absolute power, there was excess in delta, theta, some left asymmetry in her alphas, excess in beta and gamma. Again, going back to the brain marker of individual alpha peak frequency, we would automatically say, well, she was at an 11.5 and that puts her in a high decile scoring group. So in that case, we would use a 1 hertz frequency at the right dorsolateral prefrontal cortex. And so that is what was applied to her in TMS. And so she had already been treated with 10 hertz at the beam F3 location. When we did the EEG, we figured out that according to the biomarker of alpha peak frequency, she was in a high decile score. She also had the excess beta spindles, and that's a biomarker. And she did have some alpha asymmetry, left greater than right. According to Arndt's research, which TMS would we use? The 1 hertz. So I recommended that she be treated with that. She completed 35 sessions over 7 weeks. And here are her before and after pictures. This is what happened after treatment. 3 months, less than 3 months in. She had less delta and theta. There was no more alpha asymmetry. Her betas went down. Even her gamma decreased to some degree, a little bit more normalized. But here they are side by side. And to me, again, if you have good information going in, you're going to get great information in your reports. And these were beautiful EEGs going in, and so you can see the difference. Before is on the left, after her TMS of 1 hertz is on the right, and we got a lot of normalization across all bands. Clients love to see these head maps because, again, a picture is worth 1,000 words. And it's clear to everyone that, you know, if this is our norm in green, green's better. Green's better than that hot metal red. So always look at the raw EEG to make sure that, that you've got a clean input into the AI system. But when you do, you're going to get these beautiful result maps to show your clients. And, you know, it helps them understand. I mean, they know they feel better, but it helps them understand that their brain's actually changed. Okay, simplify the process. Start with the iSync wave. You know, learning to artifact and analyze an EEG can take hundreds or thousands of EEGs before you really get quick at it. But with the iSync, as long as you've got that good input, you've got a good recording, you can make sense out of those maps pretty quickly. You don't have to wait until you know the 1020 or the 10100 system. The AI analysis platform does the work for you. It enables you to quickly identify these biomarkers that we've talked about today. And you, in a couple of hours, you will be able to understand the reports and design an intervention. The iSync also has built-in photobiomodulation and neurofeedback. So use the iSync wave to confirm your diagnosis, predict prognosis, determine the effectiveness of your chosen interventions and evaluate those along the way, find the biomarkers and neuromarkers to determine the quickest path to a client's response to treatment, and determine your interventions like medications. You can add more energy and neuroplasticity to the brain through PBM. And if you want to add neurofeedback to your practice, now you have the ability through your iSync wave. And it's beautiful. I have now tried it and it's awesome.